Thanks very much, Mr. Speaker. Mr. Speaker, the long-standing difficulties in managing emergency medical services in the province continue today. They risk not only public health, but they risk the very people, the paramedics themselves. These professionals put their lives on the line when we are in crisis, and yet a recent survey reveals that 25% report an unsupportive culture of intimidation and bullying. Despite large increases in urban populations, there's been little increase in ambulances and staff, and with long wait times in emergencies and red alerts increasing, there's distress. What is the Minister?
Speaker, and to the honourable member for the question. Certainly we continue to work with Alberta Health Services and with ambulance employers to make sure that we get EMS back on the roads as quickly as possible. I think when I've talked to paramedics and other frontline first responders, certainly frustration around having to wait for people to be admitted is certainly a high frustration for some of the citizens who are transporting our most vulnerable. And of course, building the 2,000 needed long-term care beds in this province to ensure that the people who are currently waiting in acute care hospital beds have somewhere to transition to will certainly go a long way, but we will continue to work with the staff groups who represent, or the labour groups that represent the workers and the employers.
Thank you, honourable member.
Thank you, Mr. Speaker, and the Minister. You haven't addressed the question of low morale, bullying and intimidation. How is that going to be addressed?
Minister of Health.
Thank you very much, and for the following question. Certainly, conversations with both the labour groups that represent the workers as well as with the employers are a priority for us. In terms of morale, there are lots of complex factors that contribute to it, but having an open dialogue, investing in public health care, frontline health care, when people aren't worried about the future of their jobs, that certainly goes a long way to people having a greater sense of satisfaction. And if the member opposite has some feedback and advice, we'd be very happy to receive it.
Second supplementary.
Thank you, Mr. Speaker. Well, over the last year and a half, the Department has been examining effective approaches to PTSD, post-traumatic stress disorder. They've provided some supports, but they are not comprehensive and they are not seen to be reliable and valid. Will the Minister look into the PTSD program?
Associate Deputy Minister.
Mr. Speaker, and to the member for the question. We are very encouraged that Alberta Health Service has a variety of programs in place, including the Employee and Family Assistant Program, the Critical Incident Stress Management and Peer Support Program, as well as the Mental Health Line. Clearly, there is more work to do, and I look forward to working with Alberta Health Services and the Health Sciences Association of Alberta to make sure that our frontline responders have all the supports that they need.